Okay, so now we are going to start from cellular adaptations. As I already mentioned that when the injurious stimulus is not so severe, the cell can capable to adapt itself towards that stimulus. So adaptation of the cells towards the stimulus that occurs through many ways. Among them, number first is hypertrophy. Hypertrophy. So hypertrophy is the first adaptation after injurious stimulus. When there occurs injurious stimulus towards cells, the first adaptation of the cell is hypertrophy. Hypertrophy, what is hypertrophy? So increase in size of cell, increase size of cell, which lead to increase size of organ. This is called hypertrophy. There will be no division of cell involved. Now we will study the mechanism of hypertrophy, that hypertrophy, how it occurs. Mechanism of hypertrophy. So it occurs through many ways. Number first, increase synthesis of structural protein. Increase synthesis of structural protein and organelle, which lead to hypertrophy of the cell. Hypertrophy occur inside permanently or non-dividing cells. The permanently and non-divided cell, they usually undergo hypertrophy. For example, in neurons and skeletal muscle cells. All these cells, they move through hypertrophy whenever there is injurious stimulus occur, which is under the estimate to adapt towards that stimulus. So now we will discuss that example of the hypertrophy. That so hypertrophy occurs through two ways when we discuss about the examples. So it may be physiological hypertrophy, or it may be pathological hypertrophy. So first we will discuss about the physiological hypertrophy. In physiological hypertrophy, we can take example of uterus during pregnancy. It occurs as a result of estrogen stimulated smooth muscles hypertrophy. The muscles that are smooth muscles that are present inside the uterus, the estrogen hormones, that leads to the hypertrophy of the muscle cells of the uterus. And it can also be seen in breast during lactation, and it can also be seen in skeletal muscle in body builders. Usually here hypertrophy occurs which enlarge the size of the cells, but the cells number remains the same. When we remove the injurious stimulus, or when we remove the load, the cells will regain its original shape and structures. Now we will discuss pathological hypertrophy. Pathological hypertrophy. So in pathological hypertrophy, there occurs a cardiac enlargement that occur due to hypertension under hypertrophy to generate the required higher contractile force. Whenever there is a hypertension, so the heart muscles that move through hypertrophy, in order to require the contractile force, in order to maintain the heart force of contraction normal. It can also be seen in alveolar heart disease. Here hypertrophy will occur inside the left ventricle. So this is all about the hypertrophy, in which we discuss mechanism of hypertrophy, we discuss example related to hypertrophy, in which include pathological examples as well as physiological examples. So we move towards the second adaptation of the cells, and that is hyperplasia. Now we will discuss about hyperplasia. So hyperplasia is increase in number of cells that result from increase in size of organ. Hyperplasia occur in dividing cells, means those cells which has ability to divide. Now we will discuss little examples related to hyperplasia. So hyperplasia has also physiological examples as well as pathological examples. So first of all we will discuss physiological examples. Physiological example of hyperplasia includes two types. Number first, it includes hormonal hyperplasia, and the second one is compensatory hyperplasia. So in hormonal hyperplasia, suppose we can take example here, the breast during puberty, or enlargement of the breast during puberty or lactation. In compensatory hyperplasia, in which the residual tissues grows after removal or loss of part of the organ. Compensatory hyperplasia, you can easily understand that. Suppose if there is tumor on left side of liver, and we remove this tumor surgically, then what happened? Through hyperplasia, the left side of the liver, that will be completed by the right lobe of the liver. This is what we called compensatory hyperplasia. These two are related to the physiological examples of hyperplasia. Now we will discuss about the pathological example of hyperplasia. So pathologic hyperplasia can occur due to hormone axis. For example, if the hormone is estrogen, then it lead to endometrial hyperplasia in female. Endometrial hyperplasia in female. Endometrial hyperplasia can further lead to endometrial cancer. This is related to the estrogen. Now, if the hormone is androgen, what will happen? If the hormone is androgen, it will lead to benign prostatic hyperplasia. It will lead to benign prostatic hyperplasia. So this is all about the hyperplasia, that when there is an injurious stimulus toward the cell, how the cells adapt itself through the hyperplasia. So the next we will discuss in the next video, inshallah.